Welcome back to my channel, Learn with Professor Genula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about the nursing care plan for the mother who is in second stage of labor. Let's get started. The second stage of labor starts when the cervix is fully dilated and ends with the birth of the baby. During this stage, the mother begins pushing, and care mainly focuses on monitoring the well-being of both the mother and the baby. The healthcare team supports the mother by guiding effective pushing, providing encouragement, and closely observing vital signs and the baby's heart rate. Continuous support and timely intervention help ensure a safe and smooth delivery. In this situation, the nursing diagnosis is acute pain caused by strong uterine contractions and stretching of the perineal area during labor. The woman may complain of severe pain, and we can also observe signs like crying, facial grimacing, and restlessness. Our goal is to help the woman feel that her pain is manageable and support her to cooperate well with pushing. To achieve this, the nurse regularly assesses the pain level, encourages proper breathing techniques, helps the woman choose a comfortable birthing position, and provides good perineal support during crowning. Offering reassurance, emotional support, and maintaining a calm, quiet environment also help reduce anxiety and pain. When these measures are effective, the pain becomes manageable, and the woman is able to cope well during labor. In this case, the nursing diagnosis is anxiety related to fear about the outcome of delivery. The woman may express worries about the delivery, and we may notice signs such as restlessness and an increased pulse rate. The main goal of care is to help the woman remain calm and confident throughout labor. To reduce anxiety, the nurse explains the progress of labor in a clear and simple way, stays with the woman to provide continuous support, and encourages the presence of a trusted support person. The woman is also given the opportunity to express her fears and concerns freely. Reassurance, positive encouragement, and maintaining privacy and comfort help her feel safe and supported. When these interventions are effective, the woman appears calm, relaxed, and cooperative during labor. The next nursing diagnosis is ineffective pushing due to improper technique and exhaustion. The woman may complain of tiredness, and we may observe poor bearing down efforts during contractions. The goal of care is to help the woman demonstrate effective pushing so that labor can progress well. The nurse teaches the correct bearing down technique and encourages the woman to push only during contractions. Adequate rest is allowed between contractions to reduce exhaustion, and deep breathing is encouraged before pushing to improve energy and focus. During pushing, the nurse gives clear verbal guidance and continuous motivation. When these interventions are successful, effective pushing is observed and progress in labor is noted. Another nursing diagnosis during second stage of labor is risk for fetal distress related to a prolonged second stage of labor. There may not be any subjective complaints from the mother, but objectively, we may notice changes in the fetal heart rate. The main goal of care is to maintain the fetal heart rate within the normal range of 110 to 160 beats per minute. To achieve this, the nurse frequently monitors the fetal heart rate and observes the color of the amniotic fluid for any abnormal signs. The mother is encouraged to avoid lying flat on her back for long periods and is supported to rest in a left lateral position to improve blood flow to the baby. Any abnormal fetal heart rate findings are reported immediately, and the nurse stays prepared for emergency interventions if needed. When care is effective, the fetal heart rate remains within normal limits. A last nursing diagnosis during the second stage of labor is risk for perineal trauma related to rapid fetal descent. During this stage, there may be no specific complaints from the woman, but we can observe stretching of the perineum, especially during crowning. The main goal of care is to prevent perineal tears and protect the perineal area. To achieve this, The nurse supports the perineum during crowning and carefully controls the delivery of the baby's head. The woman is instructed to pant rather than push forcefully at crowning to allow slow and gentle stretching of the tissues. Proper positioning is maintained, sterile technique is followed, and the perineum is continuously observed for any signs of tearing. When these measures are effective, the perineum remains intact or has only minimal trauma. That brings us to the end of today's session on nursing care during the second stage of labor. I hope this explanation helped you understand the key nursing diagnoses and the role of the nurse in supporting both the mother and the baby during this critical stage. If you found this session useful, please like, comment, share, and subscribe for more simple and easy nursing explanations. Thanks for watching, and keep learning.